The following program does not necessarily reflect the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Liquid Green Health Show with your hosts Fred and Janet Cox right here on Reality Radio 101. To get on board right now, send us an email. Our email address is liquidgreenhealthshow@gmail.com. And now, ladies and gentlemen, right to your hosts of the Liquid Green Health Show, Fred and Janet Cox.
Good afternoon and welcome to the Liquid Green Health Show. Greetings to all our listeners and viewers across Canada, the United States, and around the globe. We are the Coxes, and we invite you to sit back, relax, put your feet where it's most comfortable, and enjoy the next hour of edutainment, hoping it steers you into an exciting journey to a vibrant and healthier lifestyle. We love your comments, folks, so please keep those comments coming. Keep them flowing to liquidgreenhealthshow@gmail.com. That's liquidgreenhealthshow@gmail.com. And please let us know where you're tuning in from. And if you're watching us on YouTube, don't forget to hit that like and subscribe button and leave a comment. Please let us know what you think of this broadcast. And you can also check us out on YouTube. Just type in Liquid Green Health Show. And of course, send your comments to us, right? And yes, those comments, as I said earlier, they are very, very much welcome. This is Sunday afternoon, and
well, shall we correct that?
Let me correct that. Today we are broadcasting not from our base, we are broadcasting from the beautiful state of New Jersey. And I can tell you it is hot. Right?
Yes.
It is piping hot. Fortunately for us, there's always the beach. Right?
Oh my goodness. And we have been to the Jersey shores. It's not the Caribbean, folks.
But it's very much like Florida.
It's not the Caribbean. It's not like Florida.
Well, it's Florida East. It's Florida East. Yes.
You can get in the water in Florida and swim.
No, not the water. Not the water. I'm just talking about the ambience. It's nice.
I don't care about the ambience. I'm talking about the water. I'm talking about the salt water.
Folks, she's crazy. She went into that frigid cold water. I stood on the shore and the water came up to my feet. Right.
And he ran out after 2 seconds.
Because it was freezing. It's
exactly.
cold.
But I did the polar dip. So folks, you know I can take cold water.
Oh, it's cold.
Jersey shores, no problem.
Anyway, it's fun. It's a lot cooler at the beach. It's about 10 degrees cooler. Today, the temperatures rose to like 100 degrees. So.
And because of that, folks, we're actually pre-recording the show. So we're still asking you for your emails, etc. But for the last couple of weeks, I've been away now. This is my third week. And
this is my second.
Your second week. So the Liquid Green Show continues no matter what.
We're on the road and we're bringing it to you as, you know, as the best we can.
It's not Sunday afternoon, but when you hear it, it will be Sunday afternoon. We'll be back in the city, but we'll probably be on the road rushing to get in. But just in case, I don't think we're going to make it for the 5:30. So
yeah,
here we go.
But anyway, here we are. So once again, welcome to our show, and keep those emails coming regardless of where we are. We're going to be reading and responding to your email.
Actually, we have several emails to respond to
when we get back. Yes, when we get back.
We will do when we get back.
Yeah. So we have an interesting guest, a returning guest, and we have a very, very interesting topic that we're going to be discussing today. And this is a topic that people should not take for granted.
Yeah.
It happens so many times, so often during the year. I'm not sure what the statistics are. Maybe you have it. You can tell them what it is. But it is something, as we get older, we need to pay attention to, right? And that topic is Stroke. That's what we've decided to talk about today, because it is happening left, right, and center, regardless of your ethnicity, regardless of your status in life. There are chances that you could be a victim, right, of a stroke.
Apparently, 1 in 6 people worldwide will get a stroke during their lifetimes. 1 in 6 people globally will get a stroke during their lifetimes.
So you want to introduce our guest?
By popular demand, is Ms. Ingrid Ballers, who hails. She's a nurse. And Ingrid, we don't have your bio, so today you're going to give us your own bio. All right? And I'm going to ask you to do yourself justice. And the reason we want to talk about stroke, recently, Frederick had a friend who we just learned had a stroke a few months ago. And, you know, we have a mutual friend who just had a stroke weeks ago. And so it's weighing heavily on my mind, on your mind.
Especially when it hits that close, the people that you know, right? And then all of a sudden, bam, they're not able to communicate the way they used to before. Right. And so, you know, it really hit home. So
okay, so Ingrid Ballers, back by popular demand, could you tell us, why are you the person to be telling us about strokes?
Well, thank you, Janet and Fred, for having me back on the Liquid Green Show. It's really a pleasure. For those of you who do not know, I have been a registered nurse for 47 years. I've just retired, a registered nurse, and I've worked in all the faculties of nursing. So I've covered all 8 faculties. However, stroke really hits home for me because my mom suffered 1 major stroke and then several mini strokes. And so I decided with my siblings that I will not have her go to a long-term care facility. I will retrofit my home and I will nurse her at home until she's no longer with us. And I have to tell you that during that time, it was 12 years. And during that time, I experienced so much. And even with my nursing knowledge, I still found it difficult at times. And so I thought, you know, there is so much knowledge that is lacking out there for the people, and people need to be equipped. They need to know, they need to be informed. And so that something like a stroke that happens very quickly without any warning, a lot of times really need to be addressed. And so I'm happy that I'm here this afternoon on the show, and hopefully I can answer some of your questions.
Okay, thank you so much. Thank you. And so with that, we're going to start off with a basic question. For all our listening audience, what is a stroke? And then I know it's a medical emergency, and correct, I know an acronym. We're going to go through all of that. But I want you to tell us, what is a stroke? Then we'll get into some of the different types of strokes. And then perhaps you can give our listeners some ideas as to how to recognize it, and even aftercare, what we need to do. So what is a stroke? Let's start there.
So a stroke is a medical emergency, as you say. We say in medicine, it's a medical catastrophe.
Oh, wow.
So it's an event that occurs when blood flow is obstructed in your brain. So oxygen supply is depleted or cut off. A stroke is considered a medical emergency. So blood supply to your brain cells is not happening. And that is because of a bleed. And that is why we call it a stroke.
So it's almost like an electrical blackout.
Yes.
The power is shut off immediately.
Correct.
And from what I gather, you say sudden, so this has to be sudden, and because the brain apparently is within minutes. What they say, Ingrid, is like the brain is 2%. It uses 20%. No, how does it go? Of the oxygen, right? 20%. Even though it's only 2% of our body weight, it uses 20% of the energy.
Yeah.
So, Frederick, you mentioned the bleeding. So, Ingrid, I know as a nurse, you're going to tell us about the 3 different types of strokes, right?
Right.
And how one is, the blood clot, the bleeding, etc. Okay.
Excellent. Correct. So, when we have this bleed happens in different ways. The first one, or the most severe one, the catastrophic one, is called an ischemic stroke. So when something is ischemic, it is losing oxygen and blood supply. And that is happening because of cell death. So the second stroke now is an hemorrhagic stroke. And when you hear the word hemorrhagic, a hemorrhage is a bleed. So the bleed is happening, but it's very subtle. The bleed is happening and you do not even know it's happening. And then the third one is called a TIA, or it's called a transient ischemic attack. And the TIA happens and also you do not know. You don't have any symptoms. So it happens like for between a minute and 1.5. That's the longest it will go. But several of those little bleeds are happening, and then it ends up with you having a hemorrhagic, a big bleed.
So sorry to cut you off, but in other words, someone could be experiencing the effects of a stroke, not realizing what's going on, and then just continue life as normal until it gets to a state where, bam, it really shuts them down.
Correct, Fred. That is correct. For example,
go ahead.
For example, my mom, I saw the symptoms, and I knew she was having several of those little strokes, those TIAs. And so when she had the big stroke, I recognized it right away.
Okay.
And
so
later treatment.
Okay. Sorry. What are the signs? What are the symptoms that someone should be looking for, whether they're the person that's having it or people around them, to recognize, hey, something is happening here?
All right. So signs of a stroke. How do you know that you are having a stroke? First, remember I said it is sudden. So you will have a sudden, severe headache, sudden numbness in your face, in your arm, in your leg. You will have a sudden difficulty in your speech. You will try to speak and you will find that your speech is being slurred. Sudden blurred vision, very common. Weakness in one side of the body. It's never both sides of the body. You're either having right side weakness or left side weakness. Difficulty in coordination. You're trying to walk and you cannot even walk. A very common one that you know someone is having a stroke, you ask them, they try to lift their arm up and they can't raise their hand above their head. So you say to the person, one of the tests we do is we ask them to raise both hands over their head. And by the time the one hand reaches by the air, it just flops. So you know the person is having a stroke. And they might complain of feeling very confused. Confusion, big one.
Yeah. So I know anything we look at, we see the acronym FAST, and you've talked about most of them, right? So they say you have to, like, I love that acronym because you have to act fast, but it also, every letter also stands for something. So the F, could you explain that to us? because that people will remember, right? For the face open.
The acronym.
So your
the F.
Your face. So you look and you a facial drooling, or you will see the person's face is discoordinated. So we will say, why is your face twisted on the one side? Why is that happening? Your mouth is twisted. Your eyes, you're not looking at the person straight ahead.
Right.
Correct?
Yeah.
So
right. And then you talked about the arm weakness, which you've said.
Correct.
And you've also spoken about the speech.
Correct.
The last one, time, T for time. It's not a symptom, but they say time is brain, right?
Time is important, Jeanette, because remember, with the bleed, your oxygen supply is depleted, partially or completely. We need to stop that bleed in your brain. So it is important that you call 911 quickly. Don't put the person in the in your car and try to get to the hospital. Reason being, remember, we want to keep the brain alive. And for that to happen, you must have oxygen flow, oxygen supply. So if you call 911 within that time, that quick time, as soon as you see it happening, 911 gets there. First thing they will do, they will start oxygen flow. They will start your oxygen. So at least, even though you're bleeding, your oxygen supply is not cutting off. And that is very important, because when your brain cells die, we cannot replace your brain cells.
That's what I have learned, that if you get it, if the doctors are able to do their thing within hours.
Within a certain 3 hours, right? Yes.
Because what I learned, Ingrid, is that, Frederick, within 3 hours,
they have a greater chance.
They have 80% chance of coming back to normal.
3 hours?
2 hours later, like within 5 hours, that drops to like 6%. And it continues. The longer you wait, the less chances you have to come back.
So what's happening during that time period? Cells are dying.
Cells are dying.
The longer you wait, the more cells die, and that's why it's so difficult.
I had no idea that it's so quick.
Yeah.
Everything is like this. This is, this is the emergency. And that the damage can be so permanent.
Yeah.
And the further away the vessels are. Ingrid, you know what I learned today? I mentioned this to you. How many miles did I say? 400 miles of capillaries in the brain.
Yes. Correct.
That's insane.
That's a lot of miles. And I can tell you the time factor, how crucial it is, because I was present when my mom was having the stroke. It was a Mother's Day, and I'd made them brunch. She got up from the table and she staggered. So right away, you see the weakness. Then she said she wanted to go to the bathroom and she could not find her way to the bathroom.
Okay.
So the blurred vision. And then in the bathroom, her coordination was off. So right away, I called 911. And that made a huge difference. My mom had a hemorrhagic stroke. When we got to the emergency, the neurologist, and this was the hospital where I work, the neurologist said to me, "Great call, Ingrid. Your mom is going to get an 80 to 100% recovery," which she did. She had all the symptoms were there. Every single symptom you can talk about, it was present. However, she got to the ER within a 15 minutes period. Oxygen was restored, blood supply kept going. Then we were able to give her the blockbuster, which I'll talk about later, which is a drug that stops the bleeding. And so she made 100% recovery.
Okay.
Wow.
With
So
major.
So the key factor here is to remember the acronym FAST.
FAST, yes.
They must get them medical aid as quickly as possible.
Yes, possible.
Yeah. Okay. We're going to take a few seconds here to do a station ID, folks. If you're watching us today or listening to the Liquid Green Health Show for the first time, or if you are a regular listener, today we are talking about a very important medical condition, and it is stroke. Right? We are into the summer months already. We're just a few days into summer. By the time you listen to this show, we'll be in summer. And summer brings heat, right? And many people across North America and other parts of the world will suffer from sunstroke, right? That's another type of stroke. So we have to be careful with this weather pattern that seems to be developing long before summer. Into summer, temperatures are very, very high. So please take care of your health. You're watching the Liquid Green Health Show on Reality Radio 101. You can check us out on YouTube or Spotify. You can also send your email into liquidgreenhealthshow@gmail.com. Let us know what you think about this broadcast.
And as we mentioned, we are a free broadcast, but please send your emails and we will read them. We'll catch up on all the emails on our next show when we're live. So Ingrid, you mentioned something. You said the first one, ischemic stroke was more severe. Can you clarify for me? Because I thought, I mean, I'm not the nurse. No, hemorrhagic stroke is more severe. Okay, good.
Hemorrhagic is the most severe one because in the hemorrhage, you have the blood vessel bursting. So you have a bleed. In the ischemic, you have a decrease in the blood flow because of the narrowing of the vessels.
Right. Okay. Thank you for that.
Yes. Yes.
And because 87, I love statistics. 87% of strokes will be the
hemorrhage. The hemorrhage.
No, the ischemic. The one that's most prevalent is the ischemic. That's the one that's most people, that's the one that get. Your mom got the hemorrhagic. So she's only like 15 to 15% of people get that one. So your mom is like amazingly lucky to have Ingrid nurse in the house. What happens to people who they live alone, they have no one? Are those the people who die immediately? Or do they still have a chance later, like 24 hours later?
Yes, they're people. See, the longer you take to get medical help, the worse it becomes. Because we're dealing with the brain function and because we're dealing with the brain cells, because we cannot really see inside of the brain, we have to go do ultrasounds, do MRI, do CT scans to see. I remember my mom's CT scan, it looked like a polka dot door. And all the dots were where she was having the bleeding all over. But then she had this big burst and she had to bleed out. But because she was there early, for the person, for example, that lives alone, get up to go to the bathroom, felt dizzy and collapse on the floor, that person is left there for how many hours or how many days after. So the deficit will be greater because remember, the bleed is happening. The bleed is happening and it continues. The bleed will continue to happen. The bleed continues to happen to a point where the pressure of the brain is built up. That person is going to die. So when you hear some people say, oh, she went to bed and she didn't get up, she had a massive stroke. That bleed that burst was so bad that they could not do anything.
Okay.
So time again is very important. Or you might have the same person that faints on the floor or became dizzy and just lay in bed all day and is having a slow bleed that will go to the emergency and get some help and still recover. However, the recovery period will be longer. That's one. Yeah. And secondly, there will be more deficits.
Yes.
There will be more deficits. So again, the key thing is time.
Okay, so from what, sorry, you had a question?
I just want to follow up on something that she said. She mentioned the person going to bed, and if the bleeding is occurring during that time and they fell asleep, you know, the damage could be
worse. Yes.
Yeah. But there's also, I've read, where sleeping for excessive period of time can lead a stroke. Can you elaborate on that?
Yeah. Because remember, what causes the stroke? The stroke is happening because there's either blood vessels that are narrowed in the brain because of fat deposits. It's happening because there are small clots there in the blood vessel that's accumulating, a little clots and a little clots and a little clots. It's happening because someone is diabetic and the effects of the diabetes is causing the arteries to narrow, so blood flow is not happening as it should. So that person will be in that bed lying and you will find them dead.
Yeah. Right. Okay.
Yeah. Especially somebody who suffers with sleep apnea.
Sleep apnea, someone that's hypertensive.
Yeah.
Yeah. Someone that has abused alcohol and drug, someone that is a smoker, someone that is a smoker, someone that has cardiac problems, heart disease, runs its their family. It's not something that they can throw out. So these are the people that you have to look, you know, they have to really pay close attention to their health.
Also, I realized that people like, you know, stress, people with a sedentary lifestyle, exercise is such a critical component, right? In terms of control, make sure you don't have stroke. And also some medications. I realized that some birth control medications and some ladies, some of the women who take hormone replacement therapy, that's a fact?
Yes, it is. So we call them risk factors. We call them risk factors.
Right.
Because even someone that who had a COVID infection, because of the infection process and because of what the disease, the COVID has done to the blood vessels, has narrowed them down. That person is so much at risk of having a stroke. Someone that is Afro, like you and I.
Yes, and Hispanic, Black and Hispanic, right.
And Hispanics,
yes.
We are at higher risk of having a stroke. Someone who has had diabetes all their life, juvenile diabetes. The age factor, don't forget, 55 and over, even though their studies have shown that there are individuals who've had stroke younger than 55. But once you hit that 55 and over, you need to really pay attention to what you are doing. Your diet, high cholesterol diet is a big factor. Watch what you put in your mouth. Simple thing as a cigarette, a smoker, high smoker, same thing.
Yeah, and now for so many people, the two things you mentioned, the cholesterol and the high blood pressure.
Yes.
Right? But then, Ingrid, would you encourage people to, when it comes to the medications, right? I know mostly the doctors will just say, take the medication, forget about everything. I mean, they'll give you aspirin and all that after you've had the stroke. One of the things, we're going to talk about that next. Some of the things we can do once you've had it to make sure it doesn't come back.
To prevent.
But
yes,
should we be trying to live a life where we can get off the high blood pressure medication, get off the cholesterol medication? Or should we just settle and say, listen, I'm 60 years old or 70 or 55 or whatever. Let me just take the medication and make life easy.
Healthy diet, healthy lifestyle. You would want to have a lifestyle that is healthy. So you would want to, first of all, look at your diet. What are you eating? What are you putting into your mouth? So try to have to exercise, walk, bike, walk. Very simple. It's not difficult to walk. It's not difficult to, you would want to first make sure that you're keeping away from the saturated fats.
Right.
Saturated fats, because those are fats that will push your bad cholesterols up. So those are the fats that will clog your blood vessels. They will harden your blood vessels, so they will decrease the blood flow. And once they're decreasing the blood flow, they will increase your blood pressure. So it's putting you at a higher risk. If you're a smoker, try to quit smoking. Try to quit smoking. Forget the cigars. Find some other alternate stuff that you can use except from having the cigarettes. Your race, you cannot change it, and your ethnicity, you can't change, but you can watch what you eat. You can have a diet that's rich, high in fiber, high in vegetables, and high in fruits. But you also have to watch the fruits for the sugar content.
Yeah. Okay. Now, the three types of strokes, the ischemic, the hemorrhagic, and the TIA, the transient ischemic attack. Now, what I learned, I want to go back to that a little bit, because this is, with us doing the research, what I realize is that perhaps, like ourselves, there's a lot of people who don't realize. I didn't know about the third type. I know about the first two. I didn't know about the TIA. Okay. Yeah. And what I've learned, Ingrid, is that they call them mini strokes, or a pre-stroke, or a warning stroke, right?
Right.
And what they say, what the statistics say, they have done studies where, just like your mom you mentioned, if you have had TIA, chances are within the next year, you're going to have the big one. I remember said Stanford, it's a big one. No, that was a heart attack. This was a heart attack, but this is a stroke, right? So within 7 days of learning that, because the mini stroke, as you said, within 1 minute, 1.5 minutes, that's it. It's gone.
That's it.
But it's setting you up that you know the big one is coming. And they say, men, folks, if the men are listening, what they say, men are the ones that, even after that happens to them, they're more likely to say, it's nothing, whatever, and they will forget about it. What should you do after the first warning? Like, now you know you've had a mini stroke, nothing happened to you, but in time you're going to get the big one. What does your doctor want you to do? What does Nurse Ingrid tell her patients to do?
So a big thing persons need to recognize with the stroke, the TIAs, they're temporary, but the ischemic and hemorrhagic, that's permanent. Yes. And once you have had the permanent damage, you cannot repair it. Right? So the first thing you would want to do is to, because you're 55 and over, you would want to take your, we call it a blood thinner. So 81 milligrams of aspirin, chewable aspirin. As a matter of fact, when you have a stroke and the the EMS comes to you, even the dispatcher will tell you, do you have aspirin at home? And you've just explained to the dispatcher that this for all the symptoms, they will tell you, if the person can chew, let them chew up 3 aspirins and give them a glass of water. Because you know what? That is a blood thinner, and it will break up the clots that's in your brain, and it will slow the bleeding down.
Okay. Something else? Sorry, go ahead.
I'm glad you brought this up, because there were times when I experienced a piercing pain. Sometimes it's on the left side, sometimes it's on the right side.
Right.
And it starts from my eye and it goes all the way back to the back of my head. And it will last for like a millisecond. But it's a severe pain, and I would just brush it off.
So what you mentioned,
it happened to me,
So he's a classic candidate then, that he should be
classic. Right? So Fred, you need to be taking your blood thinner. You need to exercise.
More.
You need to your diet. You walk, you bike, you watch your diet. You stay away from the saturated fats. So all the pastries and all the cakes and all the sweet stuff, because your starches go down to sugar, and then you have the fats. You have all this build up in your blood vessels.
Sorry, go ahead, Ingrid. I'm sorry.
Once the build up is there, the plaques are there, you're going to have a hard time getting rid of those plaques and getting the blood flow happening. Once your blood supply starts to slow down because of narrowing of the vessels, you're highly liable to form a clot. And once you throw that clot, hemorrhagic stroke.
Okay. I was going to say something. The brain. I read somewhere that it says we actually have 2 brains that's connected in the middle, right? And I know we have the different parts, the different lobes of the brain. We hear about the frontal lobe, the parietal lobe, the
occipital lobe,
and the cerebellum. And I'm trying to sound smart here, right? And the brain stem. I'm not a nurse, but I looked at, University of YouTube. I don't have 40 years of experience, so I'm going to let you talk. But different folks, when you talk to different people, like our friend, she had problems, no problems with speech, but she had problems with memory. And then your friend, I think, has problems with speech. I don't know what else. Some people have physical problems. Some people have vision problems. And I think that's because of where in the brain it happens, and right side will affect left, etc. Could you explain some of that for us?
Janet, absolutely. Janet, you're doing wonderful for not being a nurse. You've got all the dots. You've got all the ducks in a row. Now, one thing we have to remember is that stroke, whatever side of the brain the stroke is happening, the deficit crosses over. So if you're bleeding in the right side of your brain, you will have left side deficit. If your bleed is on the left side of the brain, you will have right side deficits. So the area of the bleed has a lot to do with it. So if you're bleeding frontal lobe, right side, where your frontal lobe is your memory and your speech and your cognition, you are going to have slurred speech. You will not remember. You will be confused. And you will have left side deficit. So you will have paralysis on your left side. You might not be able to use your left arm. Until my mom passed, she was not able to use her left arm anymore. However, her speech came right back and her mobility came back. She was able to walk with a walker. So the area of the bleed will determine the type of deficits that you have. And again, the time factor that the bleed is happening. Treatment, big, important thing.
Yeah. Okay.
Folks, you're listening to the Liquid Green Health Show. Today, our guest is Ingrid Bollers. She a certified registered nurse with over 40 years of experience. And our topic today is stroke. And Ingrid is giving us, have us in school today.
Yeah.
With all the things that you should be cognizant of, and how to recognize, you know, the symptoms, what to do, how quickly to get it done, so that the person that is experiencing this blackout, this massive blackout, can have better quality of life after the situation.
Right.
You're listening to Liquid Green Health Show on Reality Radio 101. Please send us those emails to liquidgreenhealthshow@gmail.com. We will certainly respond to your email at a time.
Great. And Ingrid, do you have a foot care business? Because when you're on the show first, that's what you talked about. Do you have any other medical or health businesses that you would like to share or give your number? People can contact you for anything, or is it just the foot care that you do after retirement?
Right now, I do the foot care, but my niece owns a nursing agency that's called Passionate Care Services, and I believe you had on Natasha Lee Roach on already. Yes, and so we provide help, we provide care for these patients who have had a stroke, because, and that was my next point that I was going to talk about, is the complications of the stroke. What happens after you have had a stroke? So persons will have difficulty in walking, difficulty speaking, difficulty doing their activities of daily living. So they will not be able to brush their teeth, comb their hair, have a bath, put on their clothes, eat their food, take their medication. They will not be able to do any of that initially. However, with treatment and with therapy, they will come around, and most people will come back to at least 85 to 90% of normalcy and living a normal life. However, that agency provides support for individuals, not only those who have suffered a stroke, but individuals who are elderly and cannot do their ADLs at home for themselves, still live in their home, or is in a long-term care facility and need some extra help, that those individuals, we provide service for those individuals. They might need help going to their doctor's appointment, help going to the salon for a hair appointment, coming to my office for their foot care appointment. And so we provide personal support help for them. And Janet, I believe you do have the contact for Passionate Care.
I have it, but do you have it? We will look it up and we'll provide it before the end of the show. And that's for folks in the GTA in Toronto. Yes.
Correct.
There's something I need to ask you. There's a lot of bad food in the marketplace today. A lot of food that doesn't have the type of nutrition that we are accustomed to when we were growing up. Younger people are not eating well. Some of them don't eat at all. Don't have a proper meal during the day. I want to know if among the younger generation, how great are the risks of a stroke because of bad diet and lifestyle? Are you noticing a pattern? Is it getting younger? Because you mentioned it starts more than once you get to 55, we need to pay attention.
But we are having people like 2 weeks ago, my sister called me crying because one of her colleagues' daughter, she's just 42 years old. She had a massive stroke. 42 years old. She collapsed in front of her students. She's a teacher. And why is that? Because that young lady's diet was filled with saturated fats, fast foods, fries, burgers, all of the aspartame, the Cokes, and all of the Big Macs and everything, the fast food, it's high in cholesterol. So what it's doing, it's increasing the plaques. It's increasing the plaques, which will decrease the blood flow and will create the clots faster.
And then you have the stress factor added on to that. So that just makes it a lot worse.
Don't even talk about the stress factor, the inflation.
Oh my gosh, life is stress. Frederick and I were having a discussion yesterday. We were having a discussion yesterday. And the topic, I said, I'm just trying to make life easy. I'm retired. I'm just trying to make life easy. His point was, life is not easy. From the time you were born, life is not meant to be easy.
It was never meant to be easy. You just have to learn to control it, to manage the stress. Stress management is what it's important.
So stress management is trying to make life easier.
Yeah.
You do not have to have that burger. And if you have a burger now, you don't have to have one tomorrow or 3 times a week.
Yeah.
Because our society, I mean, we're in the United States of Great America. And there are more fast food
everywhere you turn
than anywhere else in the world.
Yeah. All types.
Yeah. And they are great because we have indulged. All right? We have indulged. But when we go home, we know exactly we're going to hit the cleanse.
Yep.
And
that's
we're
right.
sure, you know, because Ingrid, hypertension, they say is 50% of stroke risk is hypertension.
Correct.
50%.
Correct.
Yep. That is like humongous, right?
And so it's important to watch your intake, watch what you're eating. And if you find that you're packing the pounds on, get on a diet, lose the weight, get rid of the weight, start a weight loss program.
Easier said than done, but we're you know what? Oh my goodness. We were at the Columbus flea market last week, and we're gonna post this picture. We have permission. We're actually gonna bring him on the show, Savage X or something. Yeah. This guy was like this, right? Yes. And he's a bodybuilder, and we just got to talking because he had all the rings on and the trophies. Yeah. But yeah, he's promised to come on, and as a bodybuilder, a wrestler, he's going to really tell us how some of the hacks we can do to get that and do some more, strength training.
Excuse me.
No, Ingrid, before time is going by, as we know, as we say all the time, Liquid Green show 1 hour has 22 minutes. We're down to less than 15 minutes. So rehabilitation, you mentioned some of the things that people need to do, some of the things they're going to need to get help with. But I heard about a drug called TPA. I didn't have time to research it. Do you know anything about that drug? TPA, that's what the doctors use. One of the main things they use, endovascular treatment. And I know they go in to try and pull the
clot, pull it out from the brain.
From the groin. Okay. And they go up to the groin and they do this. The body is amazing. Yeah. But the doctors are also.
Is it effective? Is it an effective?
It is, I think, like 70% effective. Actually, when I worked at St. Michael's Hospital, I was in charge of the cath lab. And that's the lab where that procedure was being done. So they will bring the patient in and put a stent through the groin, and the stent, you're looking at the stent through a camera, and the stent will go straight to the blood vessel and pull that clot and like shear away all of the plaque that caused the narrowing, that caused the blood flow to be depleted, that was creating the clot and causing the bleed, and it would just pull it right out. And when I saw this procedure done, I was so amazed. I was like, are you serious? This is really happening? It is happening, and it is done, and it's very effective. It is very effective. But the main thing about that procedure is that you could, during and after that procedure, you can throw clots and you can have a stroke.
You can what?
During the procedure and after the procedure, you can still throw some clots. You can start to bleed. But that's very, I think it's 11% that persons might show bleed. But it's a very effective therapy, and it has been proven, and it has been working, and it's helped a lot of people to prevent the stroke. One thing we didn't touch quickly on is the complications. I think I spoke a little bit about it. So you will have the paralysis, you will have trouble talking, trouble swallowing, trouble chewing. You will see the patient drooling on the one side. Food will come out from one side of the mouth. They will have pain. But one of the main things, or a major complication, is change in their emotion, change in their mental state. So depression will be on the increase. Some of them might be very withdrawn. They don't want to talk. They don't want to go out. They don't want to speak to anybody. They want to see anybody. And so those are some of the complications, that the major ones. And because therapy is so great, and rehabilitation starts as soon as the injury starts. So as soon as you get to the emergency and we start to treat you, your rehabilitation starts there.
Okay.
So physiotherapist comes in, occupational therapist comes in, speech language pathologist comes in, dietitian comes in, all the entire multidisciplinary team comes in, and they start to work with you as early as 4 hours post-stroke.
Okay. Wow.
As early as 4 hours.
I had a list of things on my page, and as you talk, I'm just going check.
Lots of stuff here.
Amazing. You're covering
it all.
So anyone who's listening on our station,
well, we're almost to the end of time. We don't have a lot of time left.
But we have no emails to read, so we might as well continue, right?
Yeah, we just have probably another 5 minutes, folks. You're listening to the Liquid Green Health Show on Reality Radio 101. We are the Coxes. Our guest today is Ingrid Ballers, a registered nurse with over 40 years of experience, and she has given us a wealth of information in regards to stroke, how to recognize it, what to do if it happens, and the acronym is FAST. Get it as quickly as possible to medical help. And
people like Frederick.
Yeah, I am going to take some action on this, because it has happened to me quite a few times, and I just let it go. I ignore it, so I'm going to pay more attention to that. It's a piercing pain.
Yes.
It stops you in your tracks.
And you can't blame me that I had it. No. Right?
And it's usually when I'm speaking to her.
And so. Ingrid, people who have been listening to us for the past 2.5, almost in November, in end of the year will be 3 years of the Liquid Green Health Show. Yeah. And we know that Mr. Cox here has a Oreo cookie habit.
Yeah.
And which he is trying. So I'm so glad.
Actually, I did have a couple. Had a couple of.
Yes.
It was there in the cupboard, and it's temptation. The kids
Ingrid, one other thing. Again, you're the nurse. I don't know, but we always talk about how fantastic the body is, and when I heard about something, let me see if I can find it. It's called the Circle of Willis, I think. Do you know that? Circle of Willis. And it says it's a ring where the blood can circulate from one side of the brain to the other if there's a block. Because it's like an emergency function that the brain does.
Yeah.
To correct itself.
Yes.
Yeah.
So this happens on its own until the doctors can intervene.
Absolutely, Janet, absolutely. And many people do not know about it, but it's the mechanism, it's the functionality of the brain. Because remember, this brain is losing the oxygen on the one side. And the brain doesn't want that, because the brain understands that if the oxygen supply is depleted, death is going to occur. So that circle of Willis now will allow that the blood flow to kind of go in reverse and go to the area where there is no blood. Because remember, your oxygen, you can only get your oxygen on your blood cells. So if the blood is not going, the oxygen is not going to go, and neither will the nutrients.
Right.
So and the brain is trying to survive, and it's doing what it knows.
Amazing. The last thing I want to mention, because again, as Black people, people with sickle cell, I know it's a risk factor. You talked about so many of them, and some of them, like having sickle cell, you cannot control. But that is a factor, and the autoimmune disease, like lupus, and one that really struck me was rheumatoid arthritis.
Yeah.
How is that a thing?
Remember, the rheumatoid, it's the entire body. So it's your nerve cells that's being affected. So if your cells are being affected, it will not take the blood supply to the blood vessels because of pain, because your nerve cells have died, because you're experiencing numbness, you're experiencing severe pain. So that the area, your neurons, it's not happening. The blood flow is not happening. So the nerve supply and the food is not going. And then remember, they have to deal with the pain impulses. So right away, somebody with RA, pronto, prime candidate. Somebody that has heart disease, prime candidate. Diabetes, lupus, Lou Gehrig's, like all these autoimmune diseases, they are top candidates because the other parts of the body are being affected.
And all those areas are creating blockages, right?
Yes.
So, and the body needs every drop of blood to carry the oxygen to the area where it's most.
Correct.
Correct. So we've come to the end. Before Project does its close off, I would like you to tell us a little bit more about you, because you mentioned you're a nurse for 40 years. Just give us some of the other things you've done in nursing.
And it's very short.
Very quickly, because we want to bring you back on. We want to talk about diabetes, like how we talk about stroke. And just give us a little bit more of you.
Okay, Janet. So I've done it all. And during my years, I've also taught a lot of nursing. And I've noticed, especially in the Black community, where the knowledge is really lacking. So I've started having, I call them informative sessions, where I just teach, just inform, make people aware of different disease processes, like what we did today on the Liquid Green Show. How to know you're having a stroke. How do you manage diabetes? What do you do if you were born sickle cell anemic? How do you cope? What do you eat? What do you drink? What lifestyle strategies do you put in place? And so I've done a lot of that, and I'm still doing a lot of that. I also have my diabetic foot care. That's one of my passions. Long-term care has always been my little heart tugger. So for the elderly and for the senior care, I do a lot of work with them. Basically nutrition.
Thank you. And you know what? Passionate Care, I cannot find the number because we're using my phone for something else. Give us your number. Give us your number, and somebody can always call you to get to that service.
Absolutely. So ingridballers22@gmail.com. It's my personal email. And then Ingrid Ballers at Comfort Feet Inc.
Okay.
.com is the office Gmail. And the phone number where I can be reached is 647-297-2013. And that's 24/7.
Could you repeat the phone number, Frederick?
That number is 647-297-2013. That's a direct number. And if you want to reach her by email, it's ingridballers22@gmail.com.
And I am done. Thank you, thank you, thank you.
And this has been a wonderful show. Thank you so much, Ingrid, for gracing our show. And we're looking forward to have you once again on the show. Folks, you've been listening to Reality. You've been listening to the Liquid Green Health Show. Excuse me. Go ahead.
Just before you end up with your closing, I just want to do a special thank you to Mike, who has made time this week so we could do this pre-broadcast. Thank you, Mike.
Thank you very much, Mike.
Thank you.
We are the Coxes, and this is the Liquid Green Health Show. We want to remind you that good health is at the core of human joy and overall well-being. Its influence is profound, extending beyond personal vitality to significantly bolstering prosperity and economic advancement. Thus, investing in your health is akin to investing in a brighter, more prosperous future for ourselves and the communities we inhabit. So until next Sunday, same time, same station, prioritize your well-being. This is
Janet and Fred saying,
let's stay healthy
on Reality Radio 101.
Thank you for listening to the Liquid Green Health Show with your hosts, Fred and Janet Cox, right here on Reality Radio 101.